Hi, my name is Amanda Pratt, licensed clinical social worker and therapist with Imagine Life Therapy, and I'm the chronic illness therapist. Today I want to share with you what is DBT and how can it help with chronic illness. DBT is a type of therapy called dialectical behavior therapy. Typically, it's used for people who might have challenges relating to personality disorders like borderline personality disorder. It's more famous for that, but it can actually help with a lot of other mental and emotional health challenges. And so I think people with chronic illness tend to maybe not think about how DBT could help them because they've heard of it being used for other things. But I have recently embraced DBT as something that offers a lot to chronic illness patients, and I use strategies that are within the DBT model myself, and so I would love to share with you today how DBT can help with different aspects of chronic illness management. As you know, those of us with chronic illness are constantly trying to find ways to cope with something that just doesn't go away. And so let's face it, this leaves us a few options, right? We can either feel miserable about it and stick with that feeling. We can either try to feel better about it, and often we end up trying to barter and do things that relate to that, or we can integrate it and fold it into our lives. Some call this acceptance. I like to call it integration. And sometimes we really get stuck in the first option, and the second option sounds really good, but we maybe don't know how to get there. And the third option is something that we need to learn skills to work toward, and that is where DBT can come in. So dialectical behavior therapy is something that we often put off because the word acceptance. I wrote an article on The Mighty about how I do not accept my illnesses because it was not something that I ever had a choice in receiving. It was just kind of put on me, and I think a lot of us feel that way. So I think it's okay to say, you know what, I'm not ready to accept this yet into my life, and I am ready to find a way to integrate it and do what works, so that moving forward, this experience can be less distressing and less stressful. And that, I think, is a productive way of looking at it. So one of the DBT skills is something called radical acceptance, right? Taking something and bringing it into your life, whether we think of it as good or bad. And so I will call this radical integration. I think that this is one of those things that we can lean into things, and sometimes I practice this when, especially if it's something that brings up a lot of difficult emotions, like having to use a mobility aid. I know at first that was really tough for me to adjust to, and so I practiced radical acceptance and radical integration and said, I'm going to do things with it that I would normally think to do, like having a photo shoot done, right? And some of you saw my photos that came out of that experience, and it really helped me get over that hump of it being a difficult thing to adjust to. DBT at its core has 4 main components, and they are, I have a card that's going to help me not get these wrong. 5 main components. Dialectics. Dialectics are the practice of bringing things that are opposites, seemingly opposite, together. People who often struggle with black and white types of thinking, like this is either good or it's bad. It's either going to turn out miserable or it's going to be awesome. And if I'm not at the place where it's awesome, then I must be miserable, right? Black and white thinking. So when we work on dialectics, it helps us look for the gray areas in between there. It helps us gather a more robust perspective so that it's not this or that. It could be this and that and maybe something else and some gray area in between. And that helps us expand our perspective. So that is one aspect of DBT. Another aspect of DBT is mindfulness. And so mindfulness is something that helps us get to a place where we can regulate emotions. And we do this through practicing being in the present moment. So a lot of distressing emotions live in the future, where our thoughts might be worrying or predicting terrible things happening. They can also live in the past, where we look at emotions like regret, shame, and guilt. And so the more we're in the present moment, the more we're able to experience feelings of joy and happiness, which live in the present. Then there's distress tolerance. So distress tolerance is a practice of getting really good at being uncomfortable or sitting with discomfort. And as you know, if you have chronic illness, you have to sit with a lot of discomfort. It sucks, right? And it also can be something that you get really good at doing so that it doesn't suck as bad. And distress tolerance skills will help you get there. Then there's emotion regulation. As you know, and I'm reading this really great book right now that demonstrates this. It's called When Psychological Problems Mask Medical Disorders. As you know, when you have certain medical conditions, it actually can manifest into cognitive, emotional, psychological symptoms that are not living on their own in isolation from your illness. Your illness is actually causing these symptoms as part of the illness presentation. And so emotion regulation can help us more clearly become aware of when that's the case. It can help us regulate when we have really big emotional experiences to symptoms, for example, like pain, really great for emotions related to pain management. And so learning emotion regulation skills from DBT can be really helpful for managing that. And then there's interpersonal effectiveness. So interpersonal effectiveness is the act of getting really good at communicating your needs, recognizing what your needs are in relationships, and even learning how to increase your sense of self-respect, which sometimes we can lose that, especially when we're kind of knocked out of our sense of confidence from having an illness that's unpredictable. And it, you know, things like autoimmune disease, where it feels like your body's attacking itself, because it is, and then you start to lose trust in your body, and therefore trust in yourself in terms of what's happening, and kind of having that sense of intuition and listening to your body. And so it can help increase that again. And it helps increase your ability to make and take care of relationships, which, as you know, if you have a chronic illness, it can be really hard to make new relationships, but also really hard to nurture relationships that are already there, because chronic illness changes the dynamic. And so I think doing DBT skills in the context of your now chronic illness that you have can really help shift a perspective, but I think it also will look different than it does for a lot of other people who are using DBT. So that is just a little tip about one type of therapy that I think can be helpful for chronic illness. There's a lot more involved with DBT. That's just kind of a little tidbit of an overview of some of the skills that you can learn with dialectical behavior therapy. If it's something you're interested in, please feel free to contact me and let me know if you're in the state of Florida, Michigan, New Jersey, or Tennessee. All right, I'll see you later.